So I'm actually going to read out the definition and then I'll sort of explain that. But the consensus international definition of vaginismus is the persistent or recurrent difficulties of the woman to allow vaginal entry of a penis, finger, or any object despite her expressed wish to do so. Affected women often avoid intercourse, experience involuntary pelvic muscle contraction, and anticipate, fear, or experience pain. So I read it out because there's a lot of very important factors when thinking about what vaginismus is. So physically speaking, it presents either, if it's mild, it presents with discomfort, with trying to put anything in the vagina. As it says, it could be a tampon, it could be a finger, a penis, whatever. If it's mild, it can just be uncomfortable. If it's more severe, it can be painful or very painful. And if it's very severe, then it might be impossible for anything to go inside the vagina. And the reason for that is that the pelvic floor muscles that surround the vagina tighten up or tense up. And it's an involuntary, when I show that definition, I always underline involuntary. It's an involuntary muscle contraction. So isthmus means spasm. And we would think vaginismus is a spasm of the vagina, but it's actually not, because the vagina doesn't have much muscle in it. So the vagina is actually just like a stretchy tube. When something goes in, it expands to accommodate it, like a balloon, when you put something in a balloon. But the pelvic floor muscles that surround the vagina, if we're anxious, if we're tense, or even as an involuntary process, it can tighten up. So I often say it's like blinking. If something comes towards your eyes, you automatically blink, and it's a protective mechanism. And vaginismus is similar to that. When something comes towards the vagina, particularly, if there are some anxieties going on and some worries, then, the person automatically tenses. And for some people, we hold tension in our body all the time. If I'm stressed or tense, I usually hold it in my shoulders. We have tight shoulders and my achy neck or whatever. Well, some people hold a lot of tension ongoingly in their pelvic floor all the time. So if the pelvic floor is tight anytime, then when a woman tries to put something inside it, then because the pelvic floor wraps around the vagina, it means there's not room there. And as I said, it can be uncomfortable or painful or not possible. I have to add to that, I think it's super important to add that it's very common. More than half the people that I see in my clinic have painful sex, and the majority have vaginismus. A lot of them have vaginismus, very common, but also that it's treatable. And I think those two things, because people that I see with vaginismus still often think, I'm the only one in the world with this. And sometimes they even go to their doctor and their doctor doesn't properly diagnose it. And so then they think, it's terrible, or sometimes I hear my patients say, the doctor just said, go home and relax, or go home and have a glass of wine, relax, you'll be okay. But it's not like that at all. As I said, it's an involuntary muscle contraction. And what's important is that the women actually learn how to control the pelvic floor and learn how to relax and release the pelvic floor. So it's treatable, but the answer is not just go home and relax, because if that was the answer, then this problem wouldn't exist. Just as vaginismus is not known about by a lot of people, and they think there's something terribly wrong with them and may not get the help they need, there's the other condition I mentioned called vulvodynia. And that's a bit different from vaginismus. With vaginismus, it usually doesn't hurt just to be touched on the outside, on the labia or the clitoris or the entrance to the vagina. but the pain is when something is trying to go into the vagina. But there's a condition called vulvodynia where there's pain even to touch at the entrance. And it's also a relatively common problem, but gets talked about even less. And so I sort of make it my mission, if I'm educating people, communities, just to be aware of this condition called vulvodynia. And you can look it up. There's the National Vulvodynia Association. So if sex is painful, that even just touch at the entrance without anything trying to go into the vagina, then look it up and try and find help from someone who knows how to treat it, because it is also treatable, but you need to get someone who knows what they're doing. Don't suffer in silence.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.